Hello, hello, hello.
Aqui é o outro doc, que tem muito lugar não é só o dispositivo lá, só nessa que eu tô vendo.
Hello, hello.
Ele já tá, a tela só, a tela já tá lá o sol. É esse o último vídeo, professor? Já tá no terceiro painel.
Obrigado. Hello. Oi, Edmilson. Queria que tu entrasse agora. Eu estou passando os slides para ver se está ok, tá? Como eles mudaram essa interface aqui, foi bom eu dar uma olhada antes. Interessante como essa gente não bota nome na apresentação.
junto com o novo. Mas a gente já está com outra. Essa mudada da tecnologia, a gente só tem com outra. A linha 79. Agora. Vamos botar essa dica aí.
Hello. Dear Robert and Edmilson, can you hear me? Robert, can you hear me? Edmilson. Edmilson, pode falar na rede para ver se eu ouço bem? Ah, ok. Ah.
A Verônica não pode ver você.
Hello, Robert, can you hear me? Would you please say some words? Dr. Lingley, can you hear us? Universidade Aberta do SUS. Hello, Robert, can you hear me? Ficou diferente a interface.
Som tá bonito.
Eu já tô aqui.
Eu acho que telediabetes entra em tele saúde.
Eu tô lhe ouvindo agora.
Hein?
Eu já estou escutando.
Alô, você tá me ouvindo? Ok. Robert, can you hear me? At this moment, I can't hear you, but...
Não sei se não, eles estão.
Robert, tu não tá aparecendo como estando na sessão. Eu tô tentando te passar moderador, mas tá dando como tu estando off. Tem alguma coisa errada na tua entrada ali, porque não consigo te dar moderador para os outros, eu consigo. O Robert me pediu moderador, Edmilson, mas ele tá off.
79 sal, a primeira.
Agora sim. Recomendo entrar no Firefox.
Robert, eu hoje vi que você começou a tentar no Firefox.
O meu Chrome, ele travou 2 vezes.
Ok,
Mesmo
nós
com
agora
tudo liberado.
estamos te ouvindo e todos estão ouvindo também, ok? Só vou dar uma
Eu
palavrinha.
escuto bem também.
Ok, obrigado. Boa. Hello, good morning. It's Adolfo speaking here from Brazil. I'm still waiting for our colleagues. I would like to let you know that the first presentation is expected to be made by our colleague Maria Pedro Viala about home care. And I would like now to return to the first slide of her presentation. As you probably can see, good morning, Claudia.
Bom dia, por favor, eu consigo falar nesse aqui com a Marianete? Tá bom, então, muito obrigada. Tchau, tchau.
Good morning. E alguém tirou meu slide daqui. Estou promovendo o Robert para moderador.
Engraçado, ele não aparece pra mim.
Agora ele está entrando aqui.
Que plataforma que ficou estranha.
Quer ver que hora para mudar isso a gente foi abrir aqui, Deus, cara, mas agora eu já fechei com ela. Robert, I hope you can hear us. Good morning, Claudia.
Oi?
Na mesa, se tu tiver com o microfone aberto, faz barulho de mesa, tá?
Ah, tá.
Só pra saber.
Eu?
Can you hear me? Hello, good morning. Good morning. Hello, 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 hello. Hello, good morning.
Good morning, good afternoon. Hello, Emmanuel. Welcome. Can you hear us? And hello, Mustafa Hassan. I hope you can hear us.
Hello, good morning, good afternoon. Can you hear me?
Yes, Robert. Good morning. Welcome. Is that fine
Thank
for you
you very
now?
much.
Can you see?
Yes,
Yes. Can you see the
your
slides?
audio
The
is
first
loud and
slide.
clear. Thank you.
Can you see the
The
first
first
slide, Robert?
slide. Yes, yes, yes,
Okay.
perfect.
I'm just a question. I'm searching for the second file. It's the presentation of Dr. Ling Li, but I think okay, that's okay. But probably the title of her presentation is TeleNurse Connected Nursing Care. Is that correct, Robert?
No, no, no. It's like evidence-based practice for ICU nurses.
Let me see.
I renamed it for
Ah, okay.
NWG.
Evidence practice for
NWG,
intensive care
evidence-based.
nurse acceptance of okay.
Yes,
Mhm. Okay. Mm, thank you.
no problem.
I just checked the our library and okay, here is NWG evidence-based practice for
Yes,
intensive care
that's right.
unit nurse acceptance. Thank you so much. So the first presentation is expected to be telenursing in wound care. So this is the one we have right now on the screen. Is Professor Nurse Maria Pedro Miala that will speak. I couldn't see our colleague Maria Pedro Miala because she's not online until this moment. I'm not sure if she will access the platform using the connection of Emmanuel. Emmanuel, would you please confirm that this is the link that Professor Maria Pedro Miala will use for connecting to this platform? Can you hear us, Emmanuel? And Robert, at this moment, Claudia seems to be not connected.
Let me see. But
She
she's
appears,
online
but
for me.
yeah, but she's not. It seems that I cannot promote her
Yeah,
to
it's
the
not
presenter.
connected. That's right.
Probably
That's right.
more or less the same that happened to you.
Yeah, the platform changed in various aspects, I think.
Yeah,
Even
can
in
you send a
technology
message to
aspects.
Claudia?
I will try to contact her. 1 minute.
Okay. Or she can use other browser. Emmanuel, can you hear us? Okay. Emmanuel, please, is this the same link that, no, I can't hear you, Emmanuel. Unfortunately, I can't hear you. I can see your messages. Now you asked me if I can hear you, but my question is, our colleague that we will speak about wound care, Maria Pedro Miala, is connected using your link, this link, or another one, because she's not appearing here as a member of this session at this moment. Hello? Okay.
Isso aqui não aparece pra mim.
I don't have any answer from Claudia yet, so.
Let's see. Okay, we'll be waiting.
Yeah.
I'm not sure if what happened to Emmanuel, because should I continue? Okay, Emmanuel, it's Adolfo again. You should confirm your microphone, the choice of your microphone. You can see that you can define if you are using the microphone of your notebook or headset when you started the entering this room. And my question is Professor Maria Pedro using the same connection? Robert?
Hello, I'm here.
Okay. Okay, Emmanuel has informed that he's in his own computer, and Maria Pedro is another connection, but she's not here until now. Let me check again. Yeah. see that. Okay, Professor Lingley is here, but not yet Professor Maria Pedro. Is that correct, Robert? I think so.
Yes, that's correct.
So we should wait some minutes, and also Claudia. Claudia should restart.
Maybe
Should restart her connection.
connecting.
She's trying to connect now.
I told her to download the Adobe Flash software.
Okay.
Let's see if she responds my message.
Saúde para mim, bom dia. Oi, tudo bem? Tá, eu vou receber, tá? Então tá bom. Muito obrigada, tchau.
I can't hear Maria Pedro. Hello, Maria Pedro. I hope you can hear me. In a few moments, I will promote you to presenter, so you'll be able to run the slides. You will see that now we are showing the first slide of your presentation. If you prefer, we can run the slides and you can speak, or you can run the slides by yourself. If you scroll down, you'll see that there is an arrow exactly in the area of your slides, so you can run left or right, the next slide, till the end of your presentation. It has, I counted 23 slides of your presentation, but I can't hear you until now. Would you say some words, please? No, we still can't hear you. Unfortunately, I can't hear you. Probably you need to check your microphone. I can see your message. You are online, but we can't hear you. When you enter this room, probably you could see a message asking about your choice of microphone. Hello, Group Mwamba from Cape Town. Welcome to this room. We have some minutes of delay. Professor Maria Miala, that is the first speaker, just entered the platform. So the slideshow is ready, but we need some minutes to start her presentation. She's checking again her audio and microphone. Thank you.
Adolfo, Claudia
Yes,
answered the question saying that she is with some technical issues connecting to the platform.
Okay.
Specifically installing the Adobe Flash software, so...
We can wait some minutes, no problem.
Yeah, we can wait, okay.
Also, Professor Maria Miala is not able to speak until now, so we need to wait. Robert, do you think she should go out and return to the platform? Because
Yes,
the
it
problem
would be,
probably is
yes, it
configuration
would
of
be good.
microphone.
I think so. You gave her
Yeah.
the moderator privilege?
I can give right now.
Yes, it would be
Professor
better
Maria,
for, yes.
yeah, okay. Professor Maria, I'm right now transferring moderator privilege, so you can accept that. You see a message on the screen, then you'll be able to start your presentation. Hello, Maria. We still can't hear you. Not yet. It will be. Okay, Maria, it seems that you do not have an active microphone. This is the message I can see here. Probably you need to double check the technical aspects of your microphone, because the message of any meeting says that you do not have an active microphone at this moment. I'm not sure if you are changing the equipment, but we are waiting, okay? Okay, you are trying to change. Thank you. I'm double checking about audio. Mr. Edmilson Siqueira, can you hear us?
Yes, yes.
Okay, thank you. Perfect, your audio is fine. Robert, can you still hear us? Is that okay for you?
Yes, for me it's okay.
Perfect, that's right. So probably they have specific technical issues. Claudia is not connected to the webinar and cannot be promoted to presenter. Let's see what happened.
Professor Maria, maybe should be fine if you can reconnect the session, quit the session and connect again. Maybe. Okay. Thank you.
Thanks, Robert. I see that Dr. Claudia Bars now appears, but she's not connected to the webinar. She's part of the list. I can see her picture here, but it seems she's not connected to the webinar. It's curious.
I think Claudia is connected via phone, maybe.
Via phone. Well, Claudia, can you hear us? Okay. Good morning, Neumann John from Cameroon. Welcome to this session. We are facing some technical issues right now about audio teletransmission. The first speaker will be Professor Maria Pedro Miala, but she's trying to adjust her microphone. So we need to wait some minutes. The same is valid for Professor Dr. Claudia Bartz from the United States. Thank you. Robert, are you still in contact with Dr. Claudia Bartz?
I don't have any news from Claudia.
From her side. Okay.
Yeah.
Because she's no longer appearing here. Okay, my suggestion is that we should wait additional 5 minutes. It's 10 past 9 here in Brazil. It's 10 past 2 in Brussels and Paris. So let's wait for additional 5 minutes because we need the participation of Professor Maria Miala. She needs to start speaking. And right now, her microphone is not active. Is this something related to Flash, Robert? Probably. Should they restart, enter the VROOM again?
Yes, in fact, many computers doesn't have installed the Flash computer automatically when you. Not all the platform software that you use in computer requires the Flash player. So this is a bad thing. You must do that in advance before entering the session.
Okay, but that was informed as part of the technical instructions.
Yes, we can highlight this aspect in the next platform maybe. So. This is a new thing that happened. So. I am contacting again Claudia.
And Professor Maria Miala, my suggestion she should go out of the platform and return and pay attention when starting the attendance to the VROOM when connecting, because some information about her microphone. But okay, do you have Professor Maria Miala? Is that difficult for you to use another microphone or to use another computer?
Professor Maria, have you selected your microphone and speak video options? You can try to change the configuration of your audio. If you go to the top of the screen, where you have 3 dots, one side by side, and click edit and go to audio and video options. So you can select your microphone, standard microphone, and update settings.
Okay, my suggestion from here is that we could start with the second presentation that is about tele-intensive care unit. I can change the presentation and Professor Ling Li can start speaking in this case. So if you agree, Professor Ling Li, I will give you moderator privilege, but first we change in this meantime, Professor Maria can try to connect using other computer. Okay, Robert, for you, and okay for you, Professor Ling Li. So I'm starting right now to open the next file. I'm changing now. And Professor Ling, in a few moments, I will give you moderator privilege. Just a second, please. Okay, Professor Ling Li, I'm now changing your condition from attendee to presenter, so you need to accept the moderator privilege. So you will be able to run your slideshow, or you can ask us and we can do that. We need to check about your audio. We'd like to hear from you if you can say some words. Probably you can see, Professor Ling, that your slides are now available. You have 21 slides.
Hello?
Hello, hello, good morning. We can hear you perfectly. Welcome.
Thank you very much.
Okay, as you can see, one of our colleagues, Maria Pedro Miala from Belgium, is not able to speak at this moment because she's facing some technical issues, probably something related to her microphone. So my suggestion is that we should start with your presentation, if you agree.
Yeah, okay.
I'm also waiting for Dr. Claudia Bartz from the United States, but at this moment she's not online. And I will ask Robert to inform Claudia that I think we should start because it's 17 past 9 here and 17 past 2 in Belgium and in Paris. So, okay, I see that you could change from the first to the second slide. Is that okay for you, or do you prefer that we can change the slide? Can you change the slides? Yes, that's okay. Perfect.
Yeah, it goes
That's
there.
perfect for you. Okay, okay. So if you agree, I will only say some words in order to introduce your presentation. And please, I kindly ask you to complete if I have not been exactly clear. But okay, this is in fact the second webinar promoted by the ISfTeH this year. The first was in May. So Professor Rodrigo Pires was invited as a speaker, and he spoke about tele-infectology platforms. So now we are very pleased of having two speakers speaking about very important topics. The first speaker of this morning or this afternoon in Europe is our colleague, Dr. Ling Li. She's from the United Kingdom, and we speak about evidence-based practice for tele-intensive care unit. Only one comment before asking Professor Ling to speak. is that Dr. Claudia Bartz has organized this session. At this moment, she's not connected. She's trying to connect again. I hope she can hear us. So, Dr. Claudia, we decided to change. So, the presentation of Professor Ling Li, we will start the session. In this meantime, Maria Miala will be able to change the computers, I hope so, and so she will start the second presentation. So it's my turn, and Dr. Ling Li, please, would you start your presentation? It's up to you. We are starting to record this session now, so this session is to be recorded from now on. Thank you very much. Professor Ling Li, please, welcome.
Yeah. Hi. All right.
Hello.
Hello, everyone. Thank you. Thank you for having me. I'm very appreciated that Organization of International Society and the Telemedicine and eHealth and ICN TeleNursing Network give me the chance to share what I learned in UK. Now, firstly, let me introduce myself. I'm Ling from China. I'm a master level student studying in nursing and research at University of Salford in United Kingdom. Today, in this webinar, I'm going to show you how to use evidence-based practice to improve ICU nurses' acceptance of Tele-ICU. It will be followed by three main dimensions. Firstly, I will introduce the aim of this topic and how I found those evidence to support Tele-ICU and the acceptance of Tele-ICU. Then I will speak about the barriers of acceptance towards Tele-ICU, and at the last stage, I'm going to explain the acceptance improvement strategy. My presentation will be finished around 23 minutes. After that, I will be very happy to have your lovely questions. Here, let me make a brief introduction of what is Tele-ICU. It's a telemedicine technology designed to improve healthcare delivery in ICUs. All right, see the picture on the top left. It connects a command center staffed by doctors and nurses. They connect to patients in physical ICUs. What they do is monitoring bedside patients through audio, video, and electronic reports of vital signs. They can give early warning and evidence-based data analysis to assist the bedside staff to have better decision-making, and bedside nurses can touch this button to collaborate with Tele-ICU team for information help and practice guiding. All of the works are aiming to have better outcomes of ICU patients. It's not just an interesting idea, it can meet the current needs for ICU improvement, becoming more and more popular, especially in America. Studies have published to support its effectiveness and the cost-effectiveness. Two systematic review and meta-analysis have published in recent 5 years shown that the effects of which are decreasing the mortality, length of stay of ICU patients, and facilitate staff's evidence-based practice. Also, they admit that most of the studies are non-randomized designs, which might be overestimated the effects. And most of studies show unclear of the telemedicine technology configuration and the doses tailored to ICU organization. Well, as a new way of healthcare delivery service, staff acceptance, especially the nurses, will have a significant influence to the results. The need for evidence-based practice aiming to improve ICU nurses is to have a better patient safety, quality, and cost effectiveness is needed now more than ever. Evidence-based practice refers to the integration of clinical judgment with the most current, relevant, and defensible research evidence to guide healthcare decisions and clinical practice. In 2012, International Council of Nurses reported that the 3 key elements should be focused for successful evidence-based practice in nursing: the needs and the preference of health service users, the nurse expertise, skills, and the clinical judgment, and then the most important one is to find the best available evidence. So I made a research strategy to find the evidence of nurses' acceptance towards Tele-ICU. Well, not all evidence is equally useful, but generally research evidence, because it uses systematic methods to collect and analyze observations, which is weighed more heavily in decision-making processes. Also, the better the researcher is in terms of design and execution, the more useful it is viewed to be by decision makers. The search question is formatted by PICO, which is population, intervention, comparison, and outcome. In many areas of practice, the type of the question requires that a particular research method should be used. Well, here, a qualitative methodology will be adopted because it aims to understand the people's feelings of a phenomenon, so we target qualitative studies. Research some main electronic databases such as Medline, Cochrane Library, CNAIL, Scopus, and PubMed, and hem certain including related organizations such as International Society of Telemedicine and eHealth, and International Councils of Nurses TeleNursing Network. Journals are searched including Journal of International Society for Medicine and Health, and Journals of Critical Care Nurses, and American Journal of Critical Care, Journal of Intensive and Critical Care Nursing, also the Journal of Critical Care. Resources from those organizations' websites and the journals are significantly related to the area of telemedicine and intensive care. The outcome is that there were 16 selected studies, including 1 systematic review, 10 qualitative studies, and 5 others. Well, there's no such thing as a perfect study. After printing the articles using a printer tool named CASP, those selected papers are considered to be referred. Here is one selected qualitative study with comparatively high quality. The researchers conducted an evaluation to identify perceptions, barriers, and facilitators that influence staff's acceptance and utilization of Tele-ICU. Other studies have similar findings. Conclude all the studies, barriers are identified. Confuse how to use, weak training, Tele-ICU understanding, perceived needs, and organizational factors are formed in pre-implementation stage. After that, weak collaboration, unmet expectation, discomfort with being monitored, and impact on work systems, as well the Tele-ICU understandings become the main barriers. Alright, after we identify the barriers, it's supposed to be take action to overcome those barriers, but changing any part of the healthcare service requires careful thought and planning. An individual nurse's decision to change an element of practice can rapidly have consequences for colleagues and patients. So changes are never easy as it involves changing the way people and the system behave. Alright, according to Martin's book of Project Management in Healthcare 2005 and the Lucas report of Transformational Change in Healthcare Systems, first field analysis, stakeholder analysis, and adopter analysis are considered to have a significant contribution to transformational change. Alright, They can help to develop and bring learning and resources together for improvement and change from the variety of sources, which is to ensure consistent high-quality care. In this slide, force field analysis is a management technique for diagnosing situations. It is developed by Kurt Lewin in 1997, a pioneer in the field of social science. This approach can help quickly identify people, issues, or things that could get in the way of any improvements we are planning. It can also help find allies to support us. So, to make it work, we need to act on some of the forces that have been identified. According to the power and influence grid, the stakeholder mapping will remind the manager who would be satisfied to manage, to monitor, and inform during the project. Each stakeholder's perspectives are different. For example, nurses will agree with his or her patients would benefit from the service. They will agree if they can help them overcome some daily work problems rather than interruptions. Also, they will agree if they can hopefully alleviate their stress when monitoring the patients. Not only that nurses' perspectives are different, but also their levels of adoptions towards Tele-ICU are different. This empirical finding from Roger's book in 2010, Theoretical Things in View of the Social Dynamics in the Population Model of Adoption, see the picture on the left. Each stage of adopters are roughly listed in the box on the right side, which of course would be a little different to local circumstance. Once innovators and early adopters have embraced a change, a model asserts that the early majority will follow their lead if they can interact with them. This dynamic implies that successful diffusion depends more on how an organization deals with its innovators, early adopters, and interface between early adopters and the early majority than with any other groups of phrases. And it is said that the early adopters can be opinion leaders. They often be chosen to be the leaders of the group. Early majority are readers to current local problems than general backgrounds improvements. While for the late majority, they watch for local proof. They do not find remote, cosmopolite sources of knowledge to be either trustworthy or particularly interesting. Well, the last group is the laggards. They are traditionalists who are often making choices that are wise and useful to organization, but they hardly accept new things without enough evidence-based persuasion. So, in the figure, we can know that 2.5% are innovators and 30.5% are early adopters. So together, nearly 14% of the members could be opinion leaders. For the rest is that nearly 84% of practitioners can rely on advice and the views of opinion leaders. Well, these findings can strongly help leaders and organizations to make solutions that target each barrier. Right? Apart from those analyses, a guideline of Tele-ICU nursing from American Association of Critical Care Nurses indicated that skilled communication, true collaboration, and effective decision-making can be as facilitators to improve nurses' acceptance of Tele-ICU and the patient's outcome. And this should be considered while we're making the action plan. From all the analytic strategies above, barriers and facilitators above, we can list the objectives which can help to make specific solutions. There are to prove nurses' understanding of Tele-ICU, to gain support from organization, and to improve nurses' competency towards Tele-ICU, and to design more efficient Tele-ICU workflows and systems. Well, barrier solutions will be carried out with the guide of these objectives. So, for the barrier solutions, the accountability assignment should be allocated to organization leaders and Tele-ICU leaders. For organization leaders, they should support Tele-ICU nurses in achieving and maintaining certification to work in Tele-ICU environment. They need to develop networks and IT technology support for sharing and spreading knowledge and reflection on practice. Also, they need to develop structures that support education and training. Appropriate staffing is important since we always have been facing staff shortage situation, and they should facilitate change management to support evidence-based practice. Well, for Tele-ICU leaders, they should be encouraged to be engaged in measuring and analyzing outcomes and regularly report them for gaining organizational support. Policies and frameworks should be created to better standardize Tele-ICU procedures and practice. According to the adopter analysis, they should build a quality improvement team by convening innovators and early adopters. They should set a journal club for them to improve evidence-based capacity. A workshop should be set up for experience sharing, and that is for early majority and the late majority. Well, for late majority and the laggards, leaders should design knowledge training, which includes evidence-based practice of Tele-ICU and role understanding and the Tele-ICU guidelines learning. For all nurses, they should be encouraged to attend skill training curriculums, which include how to develop skill communication, to collaboration, and effective decision making. For the last solution, it suggests that the leaders should provide opportunities for joint team meetings, which contains quality meeting, research participation, and joint celebrations. In this way, all nurses can share positive experience and discover new benefits from Tele-ICU and gain more confidence to use this technology. If we put the improvement strategy into action, it is supposed to be a form as a project. In that way, an evaluation should be carried out because it may help to determine whether it is going in the right direction, particularly if a change in environmental conditions may indicate the need for a change in the strategic direction of an organization. According to Costas' report of a business case for tele-intensive care units in 2014, regular outcome audits should be reported to organizational leaders to gain attention and support and be discussed on quality meeting. The audit includes ICU patients' average length of stay, incidence of complications of ICU patients, and the mortality rate. The second one is staff interviews. They should be designed and carried out to collect nurse perception and satisfaction towards Tele-ICU. These interviews can contribute to continuous improvement. Well, for the action, the organization will highly concern the cost, so budget should be developed carefully This table of cost appraisal is just a template roughly retrieved from FIFA's Tele-ICU case set in Massachusetts Technology Collaborative and New England Healthcare Institute in 2010. Well, each cost appraisal should be specifically taken into account of our own healthcare setting situation. Alright, today in my presentation we have shared the learning of how to use evidence-based practice to find barriers and the solutions which aim to improve ICU nurses' acceptance of tele-ICU. One systematic review of telemedicine with clinical decision support for critical care published in 2016 reported that the most studies are with poor methodological quality investigating the tele-ICU. So further multi-site randomized control trial or quasi-experimental studies with accompanying process evaluations are urgently needed to determine the effectiveness, implementation, and associate the cost. Well, my research is still relatively superficial, so I will continue to do further study in this area. This is the reference list. Developing clinical practice that is evidence-based is not merely a logical or practical process to seek and act upon evidence retrieved from research. It also involves the integration of multiple factors that influence the making of clinical decision and the results from an amalgamation of research evidence, the context of care, and integration of patient's preference. I will very appreciate to hear from you if any of you also have done some research in this area. Here is my email address. So, exploration and leading innovation has its pleasures and its risks, and yes, no shortcut. Evidence-based practice takes resource, time, and efforts, but the outcome makes it worthwhile. In the end, I feel very grateful to have two excellent supervisors, Professor Hack and Dr. Angela Cotton, who guide me and teach me in this area. Thank you. And many thanks to Dr. Claudia Butts and Robert team and me heard to support me to have this presentation. Thank you very much. This is the end of the presentation. I'm ready to have your questions. Thank you.
Thank you very much, Professor Lee. It was really very interesting to pay attention to your slideshows and the content of information. In fact, this is telenursing is really quite interesting, and tele-intensive care unit is something specific in terms of telemedicine and e-health. And it was, for me at least, very important to pay attention to the details of your presentation, and then you try to clarify some aspects related to the organization and advantages, acceptance and satisfaction of telenurses or nurses using this kind of strategy about tele-intensive care unit. Also, I think this is really very important to what you mentioned about designing more efficient tele-intensive care unit programs. And finally, I should say, developing structures that can somehow support education and training for starting implementing tele-intensive care unit strategies, and also in order to guarantee the sustainability of this kind of project. So for me, that was really very important. Thank you so much. I think we have an opportunity of having some questions from the audience. At this moment, we have 14 colleagues attending the session. So please, you can use your microphone or the chat box. Let me see if we have some questions. Well, I see that we have some messages coming from Bupe Muamba saying that thank you very much for the educative presentation, Professor Lin. Emmanuel George says, nice presentation, and he has a question. Is the privacy of the patients are acknowledged? So what about the privacy of patients? Do you have some information about this? How can you protect the privacy of patients using tele-intensive care strategies, Professor Lee?
Hello?
Yes, Professor Lee, please. We have a
Right.
question
Yeah.
from, okay, Emmanuel. He asked about the privacy of patients that are involved in tele-intensive care unit.
Well, I can see some questions on the attendee chat. Maybe the first question is from Dr. Claudia Butts, yeah? Is ICU being used as small, medium, or large number of hospitals in the UK? All right. As far as I search the articles and papers published, mostly the Tele-ICU is very popular in America and Canada and Australia. UK, they seldom use this kind of service. I don't know why, because I can't find those papers talking about United Kingdom having the Tele-ICU service. Most of the papers, those from America. So, it seems I'm from China. I'm just studying in the United Kingdom. So, why I learn and search those articles about the topic, that's why it's a promising way for the future of ICT development. It is good dissemination for me to do the further study in this area, and one day United Kingdom or Africa or China or in Asian countries, most countries will be encouraged to use this service.
Okay, thank you. Yes,
yeah.
I can see two more comments. One coming from Bupe Muamba. He asks about, from Emmanuel Vitor Jorge. Yeah, he asks about the privacy of patients. So you have some comments about this idea?
Yes. Two issues should be highly considered. One is the staff assistance, about the bedside staff and the Tele-ICU team, and how they collaborate with each other, because they have to cooperate together to have a better decision making. And previously, we always bedside nurses or doctors make a decision by their own by seeing the patient's situation. But for now, things change. That the bedside staff should collaborate when something happens. Patients' oxygen situation, such as, for example, dropped dramatically, and the Tele-ICU team should make an evidence-based data analysis with many tests and have a decision make together the bedside nurses. Another issue is the patient's privacy, right? So all we do is to have a better care for our patients. So maybe some of the patients can agree with that service because it's highly concerned about privacy. Each patient, the bed will facilitate it with camera and audio technology equipment. So if the patients don't want to be given service, they should make consent and make a signature that they don't want to have this service. but as far as I know, nearly every patient will have the length of stay of the patient, right? Thank you.
Okay, thank you, Professor Lee. There is another comment or question coming from the side of Norman Bunila John. I don't know if you can read through the attendee chat. Can you see?
Yeah. Yes.
He says, thanks a lot, Mr. Ling. So when you talk about barriers to the tele-intensive care unit acceptance, in all the points listed, you are addressing concerns on first world countries. Talking from the African point of view, there are many other points, for example, access to tele-devices, lack of training facilities, poor electricity and network access, and then maintenance. So,
Yes. I can read it clearly. So that is why it is Tele-ICU service is a promising way. Maybe this service will come true, will be used in everywhere in each countries. But for now, it's highly cost. It's very expensive for the software, for the equipment, for the computer, for the network, and for the training. And it required high quality and rich experienced staffs, including the nurses and doctors, and they can well use the technology of this service and the software. So for now, we in China, we don't have tele-ICU yet for nowadays because of the high cost and the high requirement for the staff and for the training. But we hopefully that it will be used for many countries, including African countries, including Asian countries. Yeah, so that's why I do this research. Just for America, they just nearly 30% of tertiary care facilitations, hospitals, they are having tele-ICU service. So yes, it's very promising way. That is what I want to say. Thank you.
yeah, thank you so much. Also, I see a new message coming from Emmanuel George.
Yeah.
It says, I'm aware that in India, telemedicine has been used for a long time. However, no studies has been published. Okay, I don't know if you have some comments on that, but there are some studies published.
Yeah, I think probably the databases I search is the Cochrane Library or Medline or Scopus, or published in English language. And I think India, those professors also writing in English, right? Okay, I will search further about this service in India. Yeah, thank you very much.
Yeah, there are some interesting results. Okay, this is not probably the case of tele-intensive care unit programs in India, but if you, I would like to suggest Emmanuel to read something coming from telemedicine in India in terms of the Apollo network, Apollo hospitals, because they have some very interesting projects that started several years ago and covering large areas of the country, including telemedicine for rural population. So they have a very interesting experience. So that's my suggestion. Well, we are here still waiting for Professor Maria Miala, but I think she will not be able to attend this meeting due to some technical issues, probably. I would like to hear from Robert and to know, but in this meantime, it's very important to say that It's out of air. Okay, now we return. So I'd like to thank Professor Link Lee very much for her very interesting presentation. This is a nice experience. I hope she will be able to start this kind of tele-intensive care unit strategies in her country, in China, when she returns. But that for us, this is really very important to know. So thank you very much for your contribution. This session was recorded since the very beginning. I see there is a message coming from Dr. Claudia Bars. Okay, she says, thank you, Ling Li, and to Dr. Lan and to Robert for supporting this conference. Unfortunately, also Dr. Claudia Bars, that was responsible for organizing the session, faced some kind of technical problems about her connection. But okay, the entire session was recorded, and you can also check the content of the slides, and also the audio was recorded. And I believe at this moment, okay, she says, Dr. Claudia says that she will post the recorded session on the ISfTeH TeleNursing group webpage. Very good. And we can consider probably rescheduling the presentation that was planned also for today. So about telenursing in home care. And I'm sure that Dr. Claudia Bartz and Professor Maria Pedro Miala will be able to find a slot so they can plan the next web conferencing for the telenursing working group for the next weeks or months. So thank you very much. Thank you all for your support. The technical people responsible for supporting us, Edmilson and Robert. And thank you all, members of the telenursing working groups of the ICN or the ISfTeH, for joining us. Thank you so much. Goodbye.
Bye. Thank you.
Thank you so much. Goodbye. Bye-bye.
Bye.
Aí, uma maneira da nacional, não consegui ouvir.